There's a group of men, 5, that lived together for over 35 years. Because their packages didn't match up anymore, they've told them that the house is no longer suitable, even though they've lived there for 35 years, not suitable, and they've pulled them apart. They had no choice about where they went or what they do. It's meant to be about choice and control, but because the money didn't match the need, they have no choice and control.
The NDIS has been such a mess. It's at risk of really destabilising people's lives, and I'm terrified for the people I support.
Where is the social responsibility of the government for vulnerable people?
What worries me and distresses me the most is I don't know who's coming through the door to look after Paul and the other 4 people he lives with. They are very active in the activities they do in the community, and I think they're going to lose all that.
I wish people knew about what we do, that it isn't just taking people out to the shops.
You're also coaching people, you're also understanding how their communities work and understanding how you can enable people to be included. It's much more complicated than people think.
We support people to support themselves. They live their lives and we're just there helping them with what they do need.
It's not just a job, it's never just a job.
I think you need to invest in participants, and you need to invest in getting to know their needs and their nuances and what they prefer, their preferences.
But again, disability seems to just be left in the corner somewhere.
We do deserve the good conditions that other industries may get, and how we're going to be able to create a sustainable workforce for the people that we support.
I'm angry at the state government because they promised the people that I support that nothing would change under the NDIS.
What we're facing is the prospect of a massive cut for what we're currently getting. I don't know how many people out there working in jobs would say that they'd be happy to lose 30% of the wages and conditions they've got currently in one foul swoop.
There's a lot of services that are closing. Some of them have to merge because we don't have that support or that capability.
Where are these people going to go? They're going to live independently and have no friends, no housemates. They're going to be isolated. The participants deserve a whole lot better. There's a group of quality workers, and we need to expand that. We need to educate people.
I would like to say to the state government and Jacinta Allen that your predecessors made promises. With the end of the subsidy, you're not going to be able to keep those promises. So something has to change. We need extra assistance for the transferred services. Otherwise, who knows?
They need to stand up for people with disability, for the workers who work in the industry, and support the call for a properly funded NDIS for the people in this state.
Without the EB, you're lost. You're lost. The enterprise bargaining agreement is the most important thing that we have, because it gives us a guideline on everything that we are supposed to have in our industry.
Minimum skill levels, training, things like single house supervisors.
The consequences of the EBA expiring if the Jacinta government actually do not support the subsidy for us would be a lot of changes to our working conditions.
Our agreement, as much as the staff obviously are going to lose something, the people we support are going to lose far more.
Because you would be expecting of cutting hours, cutting support services for any of our residents. A lot of people will leave because why? Why would you stay? Your working condition has changed. It's gotten worse, not getting better.
Our agreement has provided a model for a community-based accommodation and support services that meet people's needs. I'm very proud of the fact that Victoria really is the gold standard. We were the first state to decide to deinstitutionalise and move people into the community to live in much better places. And if that agreement goes, those people, the people with disabilities who are receiving the services, are going to be the ones that suffer the most.
As a house supervisor in the current EBA, I manage the house, support my staff, support the residents. We do a lot of things to make sure that our residents or participants are happy, healthy, and supported. With the new scheme, we don't know. The budget, it does not include funding a house supervisor. So who's going to go and coordinate all of those supports for them if we're not there?
So that'll see, as far as I'm concerned, a spiral down in the quality of the care across the board.
I don't think anybody wants to go back to something that is against best practice.
The time is ticking, essentially, for the state government and the federal government to fund the NDIS because so many workers are going to leave the sector.
Inconsistent staffing coming in that don't actually know the participants. There's a rollover of staff. It's sad.
We're already at a deficit in terms of how many workers are there at the moment. It scares me that participants currently still utilising the NDIS and that live in supported independent living are going to be faced with a shortage of staff to be able to provide care for them. If we're unable to maintain the current terms and conditions that we do have in Victoria, more people are going to leave the sector, and that means that there's going to be no one left, and there is no NDIS without the workers. I'd ask Jacinta Allen to put her money where her mouth is and to fund the NDIS, recognise workers for the value that they are, because at the moment they feel like they're invisible. And that's the same for participants. If you're not funding a system that provides their care on a daily basis, then you're essentially sending a message that you don't give a shit at all.
Please, Mr Albanese, come and have a look at what we do. Jacinta Allen, open your eyes up. Have a look at what we do, because if you did, you'd be gobsmacked. We are a vital industry. We can't let us go. We can't go backwards.
Elbow.
Jacinta.
Can you see us now?
Can you see us now?
Jacinta Allen.
Elbow.
Don't leave disability behind.
Don't leave disability behind.
Don't leave disability behind.